welcome in to Your Health. And we're going to talk to you, and I started to say ladies, but you know what? That's not so. We're going to talk to ladies and gentlemen, and we're going to talk about breast cancer because you know what? Men can get breast cancer too. And we have with us the lady who manages the Prattville Imaging Center. We talk about our river region on this program, and it's easy for you not to have to come to Montgomery. You have this available in Prattville. You know what, Sally Law, you are doing a great job over there, and I want to talk to our audience about the effect that COVID has had on people taking care of their health care needs.
We have noticed that with COVID over the last year that we've been in this pandemic, that the patients are afraid to come in. And just to let them know that, at all of our facilities, we're doing whatever we can to make sure that we're protecting our patients, our staff, and to come in. It's very important to continue with your health care. And any concerns that you have, you need to follow up on that. I mean, we're able to detect cancers at an early stage now with our new technology, and just to come on in and be sure to continue with your health care needs and any concerns or questions you may have to come on in.
Well, I think that people don't realize, a month or 2 months can make all the difference in the world.
It sure can, and it has hit close to home at our imaging center. We've had a young lady that we detected breast cancer with our new equipment that we have, our new technology, and she actually works there. And she was able to detect it early and get treatment, and hopefully on the right path to be cancer free.
I think that's one of the most wonderful things that has come about, and that is with all the new technology. The things that used to be just basically a death sentence really have got almost 100% cure rate. So if you get rid of that fear factor, I'm not going in because I'm afraid there'll be something wrong. That's the total opposite.
That is correct. That is correct. We are so fortunate in our community in Prattville that Baptist has invested such into the technology that we have at our center. We have recently purchased a new mammography unit and MRI unit, and it just helps in catching these cancers at an early stage and being able to treat them.
The cure rate for breast cancer is just unbelievable, Sally, if you catch it in time.
It is.
Let me ask you this, what are a few of the things that we can do as preventative ourselves, and then what is the next step? Do we go to our doctor? Do we need a referral? Let's talk about a little bit of that.
Yeah, and like you said before, it can affect men or women.
Right.
And just to encourage still to do your self-examinations if you feel anything. But not only that, if you don't feel anything, you still need to check on it, because there are some cancers that you cannot feel.
Right.
So that's really important as well. But once you get your order, you'll have to go to a primary care physician, of course, and have an order to do your mammogram.
Okay.
We specialize at Prattville Imaging just in screening mammograms, but we, reach out to our sister locations in Montgomery too, if there's a need to have further evaluation. But, you do have to have that order, and you can call us, and we'll schedule that appointment and get you in.
Okay. So I want to be real clear for our audience.
Okay.
You need to go to your physician, your family physician. Okay. But you should be doing that probably twice a year anyway, at least
once a year.
At least once, just for a physical, so that they can catch things in time. Then and that's paid for, by the way.
It is. Your insurance companies do pay for a mammogram once a year, depending on your insurance. Most of them do pay for once a year. There are a couple out there that maybe pay every other year, but we offer plans for them to come in and have their mammogram, and they can, real cheap plans for them if they don't want to file on the insurance, and they can, have their mammogram, and it's read by one of our breast specialists.
Okay. Well, you know that you don't have to be afraid of what you're going to find. That's the best thing that can happen if they find something quick, and you don't have to worry about paying.
That's right.
So, and you do have to see your physician.
Right. You do have to see your physician.
And my last question for you on this is, at what age should a woman or a man have a mammogram?
Well, there's a lot of factors that go into that. A lot, if there's a family history, it just depends on what your physician and you discuss and want to do. Generally, we say 40 and older will be your baseline there to get your mammogram, and that's what our breast specialists recommend.
Okay. All right, ladies and gentlemen, you got your orders now. Follow them, and thanks so much. Sally, we appreciate you being with us.
Thank you.
And you stay with us, and we'll have Sally back next week to talk about all the new technology. Thanks for being with us, and we'll be right back.